Today I am going to speak about hypoglycemia. Hypoglycemia is defined as sugar going below normal. That means 70, usually people start getting the symptoms of hypoglycemia, and blood sugar level below 70 milligrams per deciliter is termed as hypoglycemia. Severe hypoglycemia, when blood sugar level goes below 54 milligrams per deciliter, then we call it as severe hypoglycemia. Hypoglycemia, when it is occurring at the night time, we call it as nocturnal hypoglycemia. And how to basically detect hypoglycemia, or how one should know that whether hypoglycemia is occurring or not. So there will be symptoms of hypoglycemia. Many of the patients will develop these symptoms, can identify these symptoms. They are sometimes neuroglycopenic symptoms. That is because the brain and nervous system is not getting enough of glucose, which is very much important as a fuel for the brain. Then there will be neuroglycopenic symptoms. Patient may feel dizzy, patient may feel blanked out. There will be sometimes blackouts in front of the eyes. Patient can go blank, or if it goes beyond, means if the blood patient doesn't get help, then there can be a loss of consciousness, there can be convulsion, and in extreme cases there can be patient can go into hypoglycemic coma. But one should never go up to this stage, so they should be able to identify most of the symptoms. So other symptoms of hypoglycemia will be mainly the palpitations, sweatings, that is sympathetic overactivity type symptoms. The blood pressure will go a bit high, there will be tingling and numbness. Many of the times it is around the mouth. Patient may feel dizzy, there will be headache, or sometimes even at night time there will be vivid dreams. So different types of symptoms can be there, and sometimes there won't be any kind of symptom. That we usually term it as hypoglycemia unawareness. Then hypoglycemia, once identified, should be immediately treated, because if not treated, patient can land up into hypoglycemic coma, or if repeated episodes of hypoglycemia can lead to neurodysfunction and can lead to dementia or memory loss in long run. Because to avoid hypoglycemia, if patient is on these hypoglycemic agents or insulin, patient must take care of the eating habits. He should not remain fasting for a long time, and the meal pattern should be always properly designed, and patient should be taking kind of some amount of calories in between to avoid hypoglycemia. Whenever hypoglycemia occurs, one must treat it immediately with carbohydrate, simple sugar or simple carbohydrate can be given 15 grams initially. The hypoglycemia is very dangerous. Sometimes it can cause arrhythmias and sudden death. So it's so important, and we should be always taking care of our patients to avoid hypoglycemia. Thank you.